Thank you so much, PCSI Scientific Committee. And my deep regards to architect of pediatric cardiology sitting on the dais, Dr. Arun Singh, who actually revolutionized, who is a neonatologist, but he thought about the pediatric cardiology with his own heart. So in interest of time, I am starting my lecture. This lecture is dedicated to Professor late Rajan Tandon, who was firm believer of social security for the children born with the congenital heart defect. It's a fact check which actually being told before also. It is based on the WHO report and the status report published by our own Professor Dr. Anita Saxena and in 2018. So an estimated 2,40,000 neonatal deaths per year due to birth defect. Birth defects account for the 7% of all neonatal mortality. Commonest birth defect, as Dr. Singh said, is CHD, and over 2 lakhs children are estimated to be born with the CHD in India every year, roughly 1%. Not all CHD need interventions, neither all can be intervened. About 1/5 may have a critical CHD requiring early intervention. Approximately 60 centers that cater to children with the CHD, the majority are in southern state of India. Most of the babies born with the CHD in the most populous states like the UP, Bihar do not receive care they deserve. The lack of awareness and centers, lack of money, all contributes to high mortality, morbidity, and disability. So this is the figure taken from the same article, which shows that how good access is available for the southern state. This is because of the government policies which are run by the insurance agencies, and multiple interventions are allowed. Timely surgery is very important for the congenital heart defect because it prevents the disability load by 70%. So what is the insurance by principle? The insurer and insured enter into a legal contract and for the insurance called the insurance policy, and that provides the financial security from the future uncertainties. So that this future uncertainties is very important once you are talking about any kind of insurance. Historically, first burial club was probably made in the Roman burial club. 1583 is designated as first life insurance policy. The health insurance came up in 1920, started as a sickness fund, low cost because therapies were not available, physicians were not interested into that, but later half of 20th century, lot of insurance program came up. Inclusion of pre-existing illness. The Australia had a robust government scheme, also private insurance facilities, even for multiple surgeries for pre-existing illness. US birth defect were excluded till the concept of affordable care and Obamacare was introduced. And this is the blue book you can see. Also this policy said, however, if you are not taking a certified health insurance plan, you are going to give extra taxation, and that was the reason why there was a lot of resentment. This is the criteria for the cardiovascular system disability. Then my own journey started in my native place, a small place called Riva, where after seeing a child who was diagnosed to have a VSD at the 8th month and was not operated up to 8 years. And besides having, though parents were well off. So he converted into a Eisenmenger syndrome, and that led to this Spandan program. It was started in, sorry for the printing mistake, it was 2003. And subsequently, it was adopted by MP government in the 2009. So in this program, single surgeries were allowed. Hospital needed to do surgery and take care of parents and the ambulance. These are the different pictures which we actually, how we did camp, because patients were coming only once to the Delhi, and then subsequently their follow-up was from Riva itself. So this is me, who in 2003 and 2011, what I thought those days, that Eisenmenger syndrome can be wiped out. Money can be generated for all interventions. For those who are being operated, jobs can be created. And eventually, science will grow to bring an alternative conduit that would stay for lifelong. I didn't stop there. I thought that it was possible to have insurance for the health defect, and for bad heart, disability status can be granted when everyone would work for it. So those were my resolution and belief. I actually wrote to IRDA, Mr. Rakesh, in 2012, asking him that does any basic reference literature you have when you are denying the life insurance and health insurance to the grown-up children who were born with the heart defect. So there was no answer. Obviously, he didn't have. And then subsequently, PCSI also, we thought about it. Then coming back to issues in pediatric cardiac care and why it is very important, the good financial backup. So post-op patient, they are very delicate and multifaceted care is needed. Everything has been told to us by Dr. Arun Singh in details. Then there is need for the additional procedure. No procedure is alone. You have to go for like peritoneal dialysis or maybe many other, because there are chromosomal anomalies, there may be extra cardiac anomalies. So actually you have to go for multiple surgeries in a single go. Then there is heterogeneity of the of congenital heart disease. What is that? Yeah, if a patient of VSD is coming to you, it may be very good healthy child, it may be very low birth weight child, it may be a child having other anomalies or having the pneumonia. So outcome of CHD will always vary, and the hospital stay will always vary, and it may go up to any time. It may be 4 weeks instead of 7 days. Many patients will need reoperation. That is one has to consider. Then about the cost escalation for the setup who are giving surgery and surgical program or interventional program. So $1 to INR rate in 2010 was 45.73 and April 2022 was 76.45. Now it is more than 80. So what is happening? Because cost of living is going up, equipment, prosthesis, drug, every cost will go up. Yearly cost escalation of human resources. The doctors you are hiring, you have to increase their salary by 10% at least. So that is leading to devaluation of the quality. Means if a sister is very trained, you will let her go and you take a very new person. So devaluation of quality and hiring up inexperienced staff, and also there is stopping of upgradation of the equipments. So this is very important. Then we got the, thanks to Dr. Arun Singh, it was a very detailed work, and we got RBSK in 2013. Widespread government scheme could have been boon, but they have grossly undervalued the cardiac procedures and negatively motivated trainees. Most of the centers in the north, like my own center, banned the pediatric cardiac work. The big center like Apollo, Fortis, Escort, and Max, operating with less number of patients, and the result is underutilization of trained person and decreasing interest in pediatric cardiology and surgery, and everybody will agree on that. Then there was a thing in 90s and 80s, we heard about the brain drain. What happened after 1990s? There was brain gain because of the evolution of the evolution of corporate hospitals, which were giving a lot of facilities, good money, attractive money. But now in 2022, everything seems to be exhausted, and there is a chance people are looking forward to go outside India for getting. So public-private partnership had good fanfare to begin with. Now it is not so. Multiple reasons they are already being told. One of them is like payment system. So health equity. BPL government employees are supported by the government. Employees from the private setup pay income tax, but get no empathy from the government. Dr. Krishna Kumar wrote, I am actually quoting those lines from one of his article, a surgical procedure for a middle class family lead to loss of job of one or both spouses, loss of education for a sibling, loss of family assets, and it will bring poverty. So you are pulling the lower middle class, particularly towards the poverty, and even the middle class, even the upper middle class, if they are salary dependent. So if salary is going, then poverty is coming. So what is the health equity? Health equity is a commitment to ensuring every person can obtain the highest level of health possible, and no matter where they live or who they are. That is what Article 24 of United Nations of Convention on Right of Child says, that children have the right to good quality health care. So this is the health equity. So now the things are narrowed down on ethics of denial. So this is a Down's baby, and this is also a Down's baby, which actually go to Mount Everest base camp. This is also a Down's baby who is working with the MNCs. So should we deny treatment to those who are most needy? Because a family has to spend much more on a Down's baby to raise and then we are not going to support by the crowdfunding, by the relatively low chance of intervention, because prevalence of birth defect is less than 7%. So insurance agencies should be happy, because it is not going to convert in very high rate of claim. It provides an opportunity to mandatory surveillance for birth defect. Probably insurance agencies will ensure that second level ultrasound should be done on their economic status. Execution of policy, we gave this thing that an advisory board should be, National Council for Rights of Children born with the birth defect should be given, every stakeholder should be there. So Indian Academy of Pediatrics, its sub-specialty group, Pediatric Cardiology Society of India, Indian Association of Pediatric Surgeons, Indian Association of Cardiothoracic Surgeons, Obstetric Gynae Forum, and all other stakeholders, which include the support group after the birth, and must have annual renewal, so delayed surgeries can be accommodated. The health insurance packages for pregnancy may be extended for the newborn also. Budgeting, by broadening the net for the health insurance, where large population covered by the multiple private player will give prospect of healthy competition, downsize the premium amount, avoidance of claim conflict to sensitize the public, and will reduce the burden of government. Better financial input in the sector will allow quality growth of private health sector. That is most important part, which is in its downhill course, retention of talented professionals, capacity to buy updated contemporary high-end technology and equipments, prosthesis, as well as would facilitate a robust research potential. So these are the advantage, and this is the letter we got from the Chief General Manager, and it says, clause number 2, however, it is observed that many health insurance products that are marketed by insurer are not providing cover to newborn infant with internal congenital birth defect from day one, thus going against the true spirit of the above referred clause. In view of the above, it is reiterated that all insurance products that cover newborn and unborn shall comply with the above referred provision without any deviation, and provide the coverage from day one, without imposing any waiting period and sublimit or any other restrictive condition. These instructions shall come into force with immediate effect. So this is what later has come now. And I keep on calling Policy Bazaar with a fake identity that somebody is wanting, the pregnant woman wanting a insurance because maybe the child is born with the birth defect, and they keep on denying. But yesterday when I called one, he said, ma'am, koi baat nahi, ho jayega, kyunki abhi ek circular aaya hai yahan pe. So this circular is actually floating. So that is what it is, not the it is not in air, but it is on table. So that is what. So Dr. Rajesh Sharma, I really want to thank him, because he was very convinced, and he got these links so we could talk to the chairman of the General Insurance Corporation of India, and also Minister State, Mr. Karad, who is pediatric surgeon. And that is the reason why our things were accepted very cordially. So there is request for National Council for Right of Children born with birth defect, including PCSI, IAP, IAPS, FOXC, and patient support subgroup. So God is like the sun. When sun shines, it shines for everyone. God is for everyone. So these are my Spandan group children. They are just looking for light, and probably now there is a light end of the tunnel. Thank you very much.